I am Ardis Joy, and I will be your student nurse for today, and I will be doing the assessment of the eyes. And before I enter your room, I already wash my hands. Can I sit beside you?
Okay.
Okay. So this time, ma'am, I will be asking questions. This time, mangutan ako about history sa imo ang recent health concern. So, do you see spots or floaters in front of your eyes?
Wala.
Do you experience blind spots?
Wala.
Do you see halos or rings around lights? Kanang masyag circle mo ba?
Wala.
Do you have trouble seeing at night? Kanang halap-halap pagka basa
Wala.
ngit-ngit gabi. Do you experience double vision?
Sorry.
Kanang mo kanang mo duha bitaw ang kuan imo ang image imo ang background.
Wala.
Do you have any eye pain or itching?
Wala.
Do you have any redness or swelling in your eyes?
Wala.
Do you experience excessive watering or tearing of the eye?
Wala.
So, do you have any eye discharge?
Wala.
So this time, personal health history na ta, ma'am. Have you ever had problems in your eyes or vision sa imong imong vision na kay problema?
Wala.
Have you ever had eye surgery?
Wala.
Describe any past treatments you have received for eye problems.
Wala man.
Wala ka? So, when was your last eye exam?
Wala po ko exam. At 2015 siguro.
Do you perform the tests for macular degeneration using the Amsler chart?
Wala.
Do you have any prescription for corrective lenses, glasses, or contacts? Have you ever been tested for glaucoma?
Wala po.
So, okay, ma'am, this time ang family history. Is there a history of eye problems or vision loss in your family?
Oh, ako mama.
Ano man iyang kuan, ma'am? Na-diagnose sa iyang eye.
Giparan siya ko puma.
Nagka-glaucoma siya? So, was it treated?
Oh.
Natambalan na? Talan health practices na ta. Health practices. So, are you exposed to conditions or substances in the workplace or home that may harm your eyes or vision?
Wala.
Do you wear sunglasses during exposure to the sun?
Yes.
Do you have any vision loss? Ma'am?
Vision loss.
Oh, pagkawala sa imong pangan ba?
Wala.
Describe your typical diet. What have you been eaten? What have you eaten in the last 24 hours?
Utan. Kanoon. Tubig.
Do you take any vitamins or supplements?
Wala.
Kapanigarilyo ba ka, ma'am?
Dili.
The collecting objective data and assessing the eyes, we need first is gather equipment, Snellen chart, handheld Snellen chart or near vision screener, pen light, opaque card, and an ophthalmoscope. So second, explain procedure to the client, and then do hand hygiene. For visual acuity, have patient stand 20 feet from the chart. Test eyes separately, having patient cover opposite eye being tested. Then together, with or without corrective lenses. So, imong i-cover ang opposite eye. Kung kanimong gamiton, mo nimong gamit ipabasa, imong kabila ng isa, then read. Note the smallest line of the patient is able to read with no more than 2 mistakes. Then, have patient different pattern of colors on color plates or identify color bars on Snellen eye chart or identify figure embedded in the chart. And then, have patient hold pocket vision screener about 14 inches from the eye, normal acuity, 14, with or without corrective lenses. Corrective lenses may use, for example, inani. Sa marag inani kalay So, have your patient read 14 inches from the eye, and then you can use print size pictures if patient unable to read. So, for the peripheral vision, assess ability to detect movement coming in from periphery. So, first is stand in front of the patient face to face, about 1.5 feet apart, and then ask the patient to face gaze straight ahead with ana lang, and then cover one eye, and then bring a pen or wiggle your finger, depende na sa imo. If you have your pen, you can just wiggle this in from the periphery from 4 different fields slowly. So kung dali ka mag-start sa inferior, so i-ananin mo. And then have the patient say now pag makita na niya ang object. And then sunod superior, i-ananin mo. Wiggling slowly. And again, have your patient say now pag makita na niya ang object. And then the temporal. And then the nasal. So, again, after that, buhatan na po niyo sa pika side. So, just alternate method. And then, for the corneal light reflex, inspect the eyes for the parallel alignment. Shine light directed in patient's eyes. Note position of the light reflection of the cornea in each eye and look for the sparkle. 9 is cover and uncover test. So, cover patient's one eye and have patient focus on object afar, and then uncover eye and note any drifting. So, 10 is cardinal fields of gaze test. Stand straight in front of the patient, instruct him to fix gaze straight ahead, so ano lang, and instruct patient to follow your finger or an object such as pen through the 6 cardinal fields. So, note patients to do so and note any nystagmus. And for the external eye structure, inspect general appearance, clarity, and parallel alignment. 12 is note symmetry, distribution of eyelashes, and immersion and eversion. 13 is inspect eyelids for color, kung na may mga lesions, edema, lead lag, and symmetry of palpebral fissures or opening of eyes between upper and lower lids. And then 14, inspect eyebrows for shape and evenness of hair. And then 15, inspect position of eyeballs, alignment in sockets, protruding or sunken. And then 16, inspect lacrimal glands located below the eyebrows and nasolacrimal duct. Note the color, edema, excessive tearing or drainage of the lacrimal ducts located in the inner canthus or puncta. 17, examine palpebral conjunctiva by gently pulling lower lids down, and then to examine the bulbar conjunctiva, use a Q-tip and gently roll eyelid up. Assess clarity, color, texture, moisture, lesions, and foreign bodies of conjunctiva. And then, inspect the sclera for color, moisture, and lesions or tears. 19, assess the cornea and lens by shining a light on the cornea from an oblique angle. So, mag-note yapon kang clarity o lesions kung na kayo makita or any aberrations. And then, 20, assess the corneal reflex testing. Take a whisk or roll cotton, so magpaka cotton, and then gently touch the cornea. And take a needleless syringe filled with air over cornea and mag-note ka. So, magkuha kag syringe nga walay needle. So, imo siyang mag so gani mag field ka og air sa iyang cornea, then mag-noticing ka kung nabay blinking or tearing. And assess our risk for color and shape. So, assess pupil size, equality, and test pupillary reaction sa light. So, have patient look straight ahead. So, anay hapon. While you bring the light, so magdala kang kuan, nato yung morning pen light. And then, while you bring the light from side of the eyes, note reaction and speed in both eyes. And then, accommodation. Adjust of eye for various distance. Hold your finger or an object in front of the patient from a distance of 14 inches from the patient. So, inatagya po na kung ingon niya, inanalang galay ng 14 inches. And then, instruct patient to focus on finger or object while you move finger or object gets closer. So, ana lang. Dayon, imong kuan ni panood sa imong patient nga ay imong instruct sa imong patient na mag-focus lang ka sa isa imong finger or sa object as you go closer sa iyang eyes or the center. And note convergence of eyes and constriction of pupils as object gets closer. So, as its anterior chamber, have patient look straight ahead as you shine a light from the side across that eye. And note clarity and shadowing from iris. 25. Gently palpate the globe of the eyeball below eyebrow and note firmness with fingertips or thumb on upper lids of the sclera. Note consistency and tenderness, but do not palpate eyeball with patients with eye trauma or known glaucoma. So, dili for this no, dili kung wala man gani eye trauma ang patient or glaucoma, pwede nimo siya i-touch ang eyeballs. But when there's eye trauma and glaucoma or glaucoma patient man na do not touch. So for the internal eye structure, so this time magamit na taog ophthalmoscope. So first is inspect the red reflex by using an ophthalmoscope. Stand 1 feet from patient at 15-degree angle from patient's line of vision, and then place an index finger on the lens wheel and turn wheel as needed to focus. Keep free hand on the patient's forehead to determine distance. Shine the light beam toward the patient's pupil. So normally, a red reflex is easily seen and should be appear round with regular border. So makita na siya sa ophthalmoscope. And the next is inspect optic disc by using ophthalmoscope. Focus on the pupil and moving very close to the eye. And then rotate the dioptry, sitting until the retinal structures are in sharp focus. Observe disc for border, shape, color, size, and sociologic cup, center of disc, and note size and color. Then, inspect the retinal vessels using the above technique. Observe vessels for numbers and sets originate from the disc in pairs. So, note size, again, color, diameter, intravenous ratio, and arteriovenous crossings. And then 29, next is inspect the retinal background for color and presence of lesions. Kung na may lesions, dapat imo nang i-observe. And then next is inspect the fovea and macula. Location temporarily opposite the optic disc. Note for color again, and then lesions vessels. And then lastly, inspect the anterior chamber for transparency. So that concludes the assessment of the eyes.